So first of all, thank you really very much, everyone, to join us this night. I see some familiar face, and I'm extremely happy. It's an honor for us to really meet you and trying to explain you a little bit our program, our vision, but mostly I think we are very interested to answer your questions. So I'm Marco Del Chiaro, I'm the Division Chief of Surgical Oncology and the Program Director for Pancreas at the CU Anschutz. And I'm extremely honored to share this room with two of my colleagues, brilliant colleagues, that together works for fighting pancreatic cancer, but also, and I think that probably would be the two topics of this night, to prevent pancreatic cancer, trying to find solution in both ways, curing more people and preventing as much as we can this disease. So I think maybe we can just introduce ourselves, maybe, I don't know, Sherry or Sana, if you want to go ahead.
Sure. Thank you for the introduction. It is indeed wonderful to see some familiar faces here. Some I've recently seen. But I'm Sana Karam. I'm a physician scientist and a radiation oncologist. I treat cancer with radiation. I'm also vice chair of translational research. My focus is mainly to translate findings from my laboratory and into the clinic and initiate investigator-initiated trials. And with that, I'll give the platform to Cheryl.
Thank you. Yeah, I'm Cheryl McGeed, and I also am happy to see some familiar faces and former patients on here. And Maureen, always good to see you as well. There's my son. I am the nurse practitioner, and I'm the coordinator for the Pancreas Multidisciplinary Program. I've been doing that for about 9 years, and I'm the director of our multidisciplinary programs at the CU Cancer Center.
And we're all human and juggle a lot.
Okay, here I think we have resumed a little bit our goals. I can start to speak and then maybe Sana and Cheryl can follow. You know, it's very difficult to resume in a slides our goal. I think our goal are many and very ambitious. We can say that probably, as anticipated in my presentation, I think one of the unicity of this program is that we are caring not only about the standard of care, but there are many innovative programs at University of Colorado. And I think once you have a complex disease like pancreatic cancer, you need to think outside the box to approach the disease and trying to see, okay, what has not been done in the past and why in the past we had problems to make progress. So what we should do different. And I think two of the major issue is that in pancreas cancer, in one side, we believe for many years that prevention or early diagnosis was impossible. And I think today we have many way more to be dedicated on that. You know, we have a strong program, for example, with people with a familiar risk of pancreas cancer that Sherry actually is running. We had recently probably the only one in the state of Colorado, a clinic for cystic tumor of the pancreas, which are precursor lesion of pancreas cancer. So through the monitoring of those patients, to the surveillance of those patients, the hope is to catch the disease before it's too late. In the other hand, we can offer very advanced operation for people that normally, not only in Colorado, but in general in the United States and across the world, were considered unresectable. People in which the tumor was invading organs nearby, vascular structure. And we can offer today in selected patient operation that can, let's say, remove the tumor and giving hope at those people. So we can say in the opposite, one side, we have the prevention of perineoplastic lesion, offering selected patient preventive surgery with the most modern and minimal invasive technique, including robotic surgery. In the other hand, aggressive operation for advanced disease that before were not treated. So the idea is really to offer a new view to our patient and new options that were unavailable or not commonly available until a few years ago.
I can pop in here. So my goal really is all about the multidisciplinary programs. This is my passion. I built the Pancreas Multidisciplinary Clinic in 2012, and it was so successful in getting patients in, seeing over a one-day clinic, that we've transformed all of our other cancer programs into multidisciplinary clinics. And so what I really want is for a primary care provider or a gastroenterologist to call me and say that a patient has a pancreatic mass, and I can get the patient in, get their workup completed pretty quickly, and then get them in to see the providers who treat pancreas cancer during that one-day visit. And so that is really my passion for pancreas cancer.
I am a physician scientist. I'm actually originally a nurse by training. It was my way to get to college as an undergrad growing up in Lebanon and Beirut. And I loved nursing. I majored in nursing and biology. I was a trauma nurse. That's how I got to this country and got my green card and got my master's. As a little girl in Lebanon, I used to enjoy so much going out with my grandma and dissecting roadkills or going out to the fields. And she had a lot of animals, and just figuring out how a little goat would nurse its babies or whatnot. And, you know, as a nurse, I loved the bedside, but something for me was missing. And initially my journey took me back to science, which is my love, and did my PhD and a few postdocs, several, and then went to medical school because I missed the bedside and the patient interaction too much. And now I have a dream job. I get to do both. I get to manage a large lab, many thanks to the Philanthropy, and I would not be doing pancreatic cancer research if it weren't for that. And I get to treat patients, and I get to translate. What does that mean? I get to take my discoveries in the lab through the hard work and the long hours of my team of discovering something that did work and take it to start a trial to the patients. And that way we come full circle. My goal, my dream is to devote my career to be able to do something with these discoveries that will change the care for our patients, those that will move the needle. You've heard me say this before, and I'll say it again. I am not interested in a 5% benefit. Our goal is to eradicate. And the only way to do it is by understanding how the cancer grows, and most importantly, how the cancer spreads. And only through that, we're going to be able to conquer this disease. And we'll move to the next slide. Marco, you're muted.
I can start, yes. And I think, again, this is somehow is reflecting what I told her before. I believe basically that we need to change our mind. We need to do a mind shift if we want to improve results that for many years didn't change. So I think something really need to be think completely differently. Something is already there, and we need to share those information with people and patient, especially, and patient family. So again, I think that we have a lot of treatment or a lot of practice that we are doing today that still, I mean, is not very much justified, especially at the light of new development we had in basic science, translated then in new treatment, embedded therapies. So that's a crucial point. So we are still treating pancreas cancer in many places like we did 30 years ago. But things are changing. Dr. Schulich mentioned before the big results that cancer cure had in the last years. And even if generally we are used to say that for pancreas, that's not true, it's not like this. Actually, the step we did in the last 10 years is huge, even if it's still definitely far to be enough. And actually, regarding pancreas cancer, regarding the data that Dr. Schulich mentioned before, more or less, the survival of pancreas cancer in this place is almost double than the medium, the national average. So not only we did a lot, but we are doing extremely well at University of Colorado. Another important thing is that when you treat cancer in general, and when you treat cancer, especially rare, if you want, or complex cancer, there is a need to be transparent with our patient, and centralization and volume is crucial. And this is very well demonstrated. So one of my other idea in how we can go against pancreas cancer, beside investing in prevention, in new treatment, in new biological criteria, not just anatomical criteria. So who really deserve a kind of treatment, who deserve another kind of treatment, we need to treat those cancer in high volume center. And we need to share the information that people cannot receive the same treatment everywhere. This is maybe impolite to say, but it's very true and very much based on numbers and results. And this, I think, is a mission that as doctors, we need to do and share with our patient, and use all the way possible to let them know that make a huge difference where you're treated and who treat you. And especially in a multidisciplinary setting, if there are 25, 30 brains thinking about your treatment, is better than it's only one. As good as it is never like having 25, 30 people deciding together for your care.
And I love that. I love sitting in the MDC and listening to the various opinions, the discussions, sometimes the disagreements. But one thing that, as I sit there, I often think is, boy, wouldn't it be nice to have something better than a CAT scan that could tell us whether this is really true regression or not? Wouldn't it be nice to have molecular markers that can tell me if this patient is going to respond to this therapy or not? Wouldn't it be nice to know if this metastasis means a dim prognosis that could benefit from a new immunotherapy, or it's just a monoclonal spread that could respond to conventional chemotherapy? That's what I would like to see the next generation of MDC go through. And I think the way to do that is through basic science, not just me, but worldwide. We need more investment in the basic science, in the basic translational, to be able to kind of push the field forward. It would be nice to get molecular subtypes classification based on tissue, based on diagnostic imaging. And it would be nice to actually have trials where we can get a signal right away to be able to change course if someone is not responding. Next.
Well, this is, I think, I will be very short. I think Dr. Schulich already spoke about that before. You know, research is the only way to improve results. And research is means a lot of investment. And I think this place, as many other cancer centers, can have results only because of generosity, sensibility, participation of many people. That's really the only way we can improve our results. Again, we did a big step thanks to philanthropy, but it's not enough. It's not even far to be enough. And there are many other steps that we have in front of us. And only working together, only with participation and generosity, we can achieve our goal.
Couldn't agree more. Well said. I actually remember a few years back when I was ready to shut down my lab. I did not have money, but we're doing good science, but we were running out of funding. And as a physician scientist, you get to generate your own salary and personnel salary and whatnot. And I remember my colleague, my wonderful and really my best friend, Karen Goodman, who was here at the time, she's like, don't give up. Why don't you just apply through Philanthropy and apply to some grant funding? And I remember needing a letter for a grant I was submitting, and she's just like, here's Maureen's information. Why don't you call her? So I think I got in touch with Maureen to get a letter for a DOD grant or something where I needed patient advocate. And she was amazing. And if it weren't for that, I don't think I would be studying pancreatic cancer. If it weren't for the seed funding we wouldn't have a program. We wouldn't be applying for large scale $2.5 million, $5 million funding if it weren't for your generous donation of that $50,000 here, $50,000 there. If it weren't for the philanthropic investment, my postdoc, who just secured his first major funding, who was funded here locally by the Paul Sandoval and the Wings of Hope, would not be where he is today. I just got an email, a beautiful email today from MD Anderson saying what a great paper you generated in the cancer research. We just wrote a commentary on it. And I felt obliged to tell him, well, I really can't wait to share that news with Maureen because I think she'd be thrilled. So I don't know that I will ever have enough words to thank you. But really, I wouldn't be here today saying what I'm saying if it weren't for your generosity. So thank you.
Thank you, Sana. That's beautiful. And I also have to give thanks to Maureen as well for the Wings of Hope Foundation for giving 100% of the proceeds into pancreas cancer research. It's truly made a difference with us. And another grant that we've received, a philanthropic grant, is the 1440 Foundation, which is a team learning network of improving pancreas cancer multidisciplinary care across the country. And this is something that we are involved in, and we are collaborating with now, I think 14 centers across the country, and in trying to improve multidisciplinary care with pancreas cancer patients. And it's truly made a difference. Even in the 9 years I've been doing this, it gives me new ideas on how we can improve our program, and we're really grateful for it. Philanthropy really has made a difference in our pancreas cancer treatment, and thank you so much.
Thank you, doctors. I really appreciate that presentation. I'm going to stop the recording here and let us all see each other again so that we can ask questions.